Good morning, good afternoon, good evening, wherever you're watching from. Welcome to this live program from Shifa Holistic Healthcare, where we're talking about cupping therapy today. A lot of people ask about hijama and cupping therapy, what it does and what it doesn't do, and the benefits for it, so to speak. Well, hijama and cupping, hijama therapy, cupping therapy, Kaho, as it is called in northern Nigeria, and it has a lot of other names from different parts of the world, you know. And it's a very, very, very old therapy. It's holistic in nature, and it has so many benefits that science is still looking to try and confirm and find out and be at par with. So, what does hijama or cupping therapy do? It basically, in a nutshell, they will tell you that, in summary, hijama removes dead blood and toxins from the blood, and it clears the lymphatic system, lymphatic pathways in the body. But it actually does more than that. It is very good for pain relief, for organ rejuvenation, for mental ailments. And when you look at organ rejuvenation, it goes further because you're looking at how to treat various deficiencies in the organs, be it the kidney, be it the heart, be it the liver, be it the lungs, the stomach, and like that. It helps with fertility-related issues, both for men and women, erectile dysfunction for men, the inability to conceive for women for various reasons. It helps with the treatment of spondylosis as it relates to the whole spine, cervical to the coxal, the whole length. It helps with memory. It helps with rejuvenating the brain, especially when you're treating stroke patients, paralysis patients. It helps with arthritis, especially for the knees and other parts of the body. There's so much that cupping therapy does. It's not something that you would put a list for. Just like with acupuncture or acupressure, there are certain points they call like the 100-point cure point, like stomach 36, there's a lot of things. DU20, there's a lot of things. But you see with hijama, you have points like that just that one point would take care of about 70 or so different ailments, about 72. And science is proving this right, just like science has been proving things that were said so many years ago right today, even though we still have doubting Thomases. But with hijama or cupping therapy, it's a very, very old therapy that to a great extent has kept practically everything about it, its principles and its science intact. So the modernization of it is just to do the same thing in a different way, so to speak, or to bring variety to it, added value, so to speak. And nobody will tell you when the first hijama was practiced. Nobody has that knowledge. As far as I know, and the books have said, the most you would hear is that in one dynasty in China or in Mesopotamia, they found records that cupping was practiced maybe 3,500, almost 4,000 BC. When you say now 4,000 BC, that makes it about 5,000, almost 7,000 years ago. No, 4,000 to 6,000 years ago. So So you find out that it's been around various civilizations, and they practice it almost the same way. The way we practice it here in northern Nigeria, the north, you find they use horns, cow horns, to get that pressure point and to to create the pressure. The same thing is done in other parts of the world. In China, they still use the horns. In some parts of Latin America, they still use the horns, amongst other things. But the principle behind cupping is to create negative pressure. This can be done either using fire, with fire cupping, where the flame is introduced into the cup, and as it cools, it creates that negative pressure to pull to the location you want. And what does it pull? When you put the cup in a position, it pulls blood to the surface, closer to the skin surface, and the lymphatic system, and so all those little debris that are there that the liver has to deal with, the kidney has to deal with. A good portion of it comes there. So some people even describe cupping therapy or hijama as an external kidney for the body. While it pulls there, it stagnates, it gathers there. So you see different kind of readings from the cup, from clear that there was nothing wrong with that part of the body or that organ is in good shape, to it's in very bad shape, where you see dark patches with heavy stagnation. Sometimes you find out that there's some pus coming out from there, or some blistering when there's too much water or so in the body. You find out that you could see some blood too, even before you make an insertion. Knowing how to read these points tells your therapist what is going on present and what could go on in the near future. So you find a need to find a good therapist, a qualified therapist, if you want to practice or you want to have hijama or cupping therapy done for you. There are a lot of people that just do it because it is a simple or looks relatively simple to do. But like every other thing, you have to learn, as far as medicine is concerned, how you need to do it properly, the science behind it, which a very large number of therapists don't know. You have to understand the body from that perspective of the copper, or the hajam as it's called in Arabic. If you were looking at the body anatomy from the Western medicine point of view, you would not make a balance. So you would always have a problem treating, or diagnosing rather. And the process itself is simple. It's non-invasive or very minimally invasive. It does not involve stripping the person naked, in practically all cases. There are very few times that you have to actually go to that level where some parts have to be exposed because you need to do cupping, and you find out those are very serious cases. But it's very rare. It's mostly the back and some parts of the front, but it's not everywhere you bleed also. So it's not about pulling blood from the person. It's pulling what is there to be pulled. As they say in training, when there's nothing to be taken out, nothing comes out. It is only where you have things that need to be taken out that comes out. So you could have the same session at one point and there's no blood coming out, sometimes just small pores or some sweat-like fluid that looks like sweat. And the benefits are enormous. It helps relieve insomnia and gastritis. It helps relieve so many things that once you've had it done once, you would want to do it over and over and over again. But what is the main difference between cupping as cupping therapy or hijama? as hijama. Hijama therapy and cupping therapy, they're practically procedurally the same thing. You have wet, dry. You take out blood from wet hijama or hijama itself, and wet cupping and you don't take out blood for dry cupping, or when you're practicing dry hijama, la shab, with no blood coming out of it. And the difference is in intention. Hijama itself has worship tonation to it. It is a sunnah. And for the Muslim, when he does hijama with the right intention, he gets a reward. The same kind of reward he gets when he does a nafil prayer, or that he does a nafil fasting, or that he does any other thing that is nafil that he can do that is recommended by Nabi Sallallahu Alaihi Wasallam. So when you do that, you're getting your healing and a bonus, a reward of doing a good deed, and the reward of possibly a bad deed being struck off your record. So that's the, in summary, difference between hijama and cupping, that there's a religious part to it, of worship to it. And having said that, every other thing is about the same. They are based on the same principles. If you go deep into their science, they all border to the meridian system, where you find that the body, according to traditional Chinese medicine, has some invisible meridians or energy lines, which they call the meridians. There are 12 of them, and then they have extra points and things like that. So if you look at where your points are being put, you find out it has to do with those points, most of them, and those extra points that you put for other things. Yes, there's cosmetic cupping to, like for me now, if I did that, all this will come smooth and I'll be looking like one young chap again without these small wrinkles like that. Maybe I should try it and go. You can treat eye problems with cupping. You have a cup here, a cup here, a cup here, sometimes here, and at the back of the head, the occipital area of the head, like that. Sometimes it leaves some dark patches, which will be there for some days, and it goes. But there is no side effect per se that you do hijama, apart from those contraindications that you find with everything else. You don't do hijama on a pregnant woman, except at point of labor. If you want to help relieve, there are certain points you could put a cup that will help her deliver fine, but not before then. You don't do hijama on a wound, a part of the body that has sores. You don't do hijama on somebody who is very anemic and about to, you don't do hijama on somebody who is fasting, not because it will break his fast, so to speak, but more because it relaxes the body, and you don't want somebody who is already weak to go weaker. And you find across the table, when you do hijama on patients, from those who fall asleep on the bed even before you finish, to those who just get up and want to go and sleep, then you find those who just tell you they're feeling lighter and relaxed, to those who feel very energetic and tell you they feel like going in for a boxing match. So depending on what the underlying problem is and the balance you're bringing. But hijama in itself is a very, very good therapy. If you Google on research, especially if you're using research-based programs or browsers, Google Scholar or any other app or search engine that deals with scholarly materials, you'll find that yes, there's so much that is being researched now. You see sportsmen, swimmers, athletes and co, with round patches behind their back before competitions because they've gone for hijama. It brings their body back to par, and that does not go under the doping law, so you cannot hold them for doping. The anti-doping law does not touch it because there's no drugs involved, and it's just clearing your system. It's like a cleanup, dusting, taking out every dirt, cobwebs and co in the body. And can anybody practice hijama, even if he or she does not have a medical background? Yes and no. Yes, to some extent, you need to learn. So by the time you finish learning, you would not be without knowledge of anatomy. By the time you finish learning and are certified to practice hijama or cupping, you will be knowledgeable to a point whereby you know the human anatomy to a relatively good extent as per allopathic medicine, and you know it to a very good extent as relates to traditional medicines. You understand the hot-cold balance, and you understand the imbalances that could come. You understand how to read some lab test results, because more times than not, patients who come for hijama come in after they have gone for some form of diagnosis. It is after those ones who are satisfied now come back to you and say, look, I don't feel good, I have this pain, this joint pain, that, and then you diagnose and you treat. Then as a hijama therapist, there's also a need to understand to a great extent the use of herbs. Use of herbs not in naturopathy or herbal medicine, but use of herbs based on traditional medical science, the temperamental values of herbs, because your treatment is based on temperamental theory of the body. It's not based on active components or individual organ treatments. No, you're treating holistically. So you have to understand how these herbs work. So a therapist in that case is more or less his own pharmacy. Wherever he goes to, he doesn't need to take any herbs or anything, preparations. He looks at the plants you have there and he can read them and understand which plant would treat what, which plant would help build bone back, which plant would help build muscle back or blood back or improve quality of eyesight or help with ulcers and stuff like that. After he has done his therapy, he would give you something to help the body build itself. A lot of these ailments we have today are due to deficiencies caused by our eating habits. You will find people who, from January to December, do not take any fruits, not oranges, not bananas, not apples, not pear, not any fruit, not dates, nothing. Then you find those who it's just during Ramadan because it is available, people give out some dates, so they take dates, and once in a while they get watermelon or pineapple or so. But when you don't eat these things, you find people who don't eat salads at all. They even make it a point of pride. I don't eat salad. Salad is grass, it's for goats, it's for whatever. But then he misses out on the nutrients. So you find the body deficient of so many things. Then, of course, Big Pharma takes advantage of the guys. What will I put? I don't see the good word to use, but the guy's inability to take care of himself, to eat right, and nourish his body well, and they start selling supplements. So you find people telling you this supplement, you're buying supplements, it's because you're not eating right. You eat rice and stew, no salad, nothing to follow it. And this is mostly for the, end quote, elites, the elites in it, the guys who want to be the big boys, so to speak, or the wanabamba big boys, as they say. And you find if you go to a construction site, the laborers eat well. The people who come in with rice or other things for them always have a small pack with salad inside. They eat a lot of vegetables. You find some people actually here pushing, I don't know in other parts, but in Kaduna you see them pushing a wheelbarrow. They have cabbage, lettuce, parsley or lansir as the alternative they use, some carrots and onions, and they dice it like if they were making coleslaw. They mix it for you, put small oil and sometimes groundnut powder. The big boys don't eat this. The small boys eat it and you see their skin glowing like they polish it. So you find out that some of these ailments are deficiencies. So when you get the organ to start doing its work proper, you have to feed it with the things it needs to feed it to do its work. So the therapist, yes, you can learn from scratch without any medical background. We train people. We have a training program going on right now, and basic training is 6 months. The advanced diploma is a 9 month program for Hijama too. So you do the basic, then you come in. If your basic results are good, then you just do another 6 months. So you essentially spent 12 months in learning over and like that, the clinical programs we do. But Hijama is a very good therapy, cupping therapy. It does wonders to the body. It does real wonders to the body. If you've never tried it, then you should look for a good therapist and try it. Possibly come into Kaduna, and whenever you're in Kaduna, we would you pass through our clinic. Inshallah, we would be able to have a session with you, diagnose you fully, and do that. But there's a lot of benefits in hijama cupping therapy. Inshallah, we will continue with this small talks as we go along. Have a great day, and may Allah make it easy for all of us. You know. Now, how do I stop this?